It's great to have you here. And before I ask you about your the interesting thing you're doing on working with patients, how difficult was it to organise such a wonderful, broad-reaching conference as this?
Well, it is really a huge challenge to arrange these conferences. We have arranged people from all over Europe to arrange these. There's a committee, scientific committee, to arrange it, and these people are from all over Europe and in different areas of the cancer nursing. So
and are you finding that people are beginning to think with one mind and speak with one voice?
Yeah, they are. They are trying to really, even though some think it's hard, also because of the language barriers. That's still some things that we are, struggling with the language barriers. Because so we're trying to, the eastern countries of Europe. We're trying really hard to get them involved in both these conferences and also working groups, and because that's sort of something they always say. Yeah.
Well, Europe is indeed very varied at the moment. So are there big inequalities in care, nursing care, from one country to another?
Yeah, they are, because but for the financial crisis, some countries also, they experience that the nurses really the healthcare system want them to have more education, and they really will maybe apply for more education, but then when they have the education they tend to move maybe to another country also, because they can't get a job there, and so that's some of the problems we're facing.
Brain drain.
Yeah, exactly. Because
you're stressing though here at the conference working with patients, and I know you've personally been concerned with the European Cancer Patients Coalition.
Yes.
What have you been doing, and what do you mean by working with patients? Isn't that what medical carers do all the time?
Yeah, but we do it in the clinical way, but I do think it is so important also at the political level to work together with the Cancer Coalition, and especially the ones in Europe, the ECPC as they're called. We work together with them because patients, when they have stronger voices than the clinicians or the physicians or the nurses in the political areas, the EU.
And what's coming out of this? I mean, what do you mean by working with patients?
Yeah, we have especially worked on the personalized medicine area, and together with the patient we have tried to make it more like personalized treatment and care, because the personalized medicine is really about genomics, DNA, and the medicine really targeting the DNA and the right medicine for the right patient in the right time. But we're saying it's much more than that. It's more a holistic approach. You should also think about the patients, the social status, how did they experience something else in their life before that? How did they cope with that? And so we're trying to, and the patient and the nurses now have a voice there. And it's also about educating the healthcare professionals.
What sorts of things have you got to say about improving personalised treatment and care? Then that are really, give me a few practical examples.
We have tried to say that it's very important in the communication with the patients that the patients do understand what it's about, the personalized medicine, treatment and care, because a lot of patients they think that they have a choice, but they don't really know the choice because they don't understand what it's all about. So in that way, if we educate the nurses and the patient together with the patients, knowing what is needed to know about this, we can have a really good collaboration with the patients about this, because it's about their lives. Even if it is personalized, it is something about the whole life of the patients. And so the interview and the communication should not only be about the medicine, but about a lot of stuff about their work and social. And so this is the things that we have put into that personalized medicine. It's a coalition in EU now.
Yes, and the nursing input is a significant part of the multidisciplinary approach too.
It is, because there's right now it's like 10 or 15 physicians from various areas sitting there, and there's only one nursing voice right now. And so we are actually EONS, the European Oncology Nursing Society, is now in the lead for the education of the healthcare professionals. So that's where we have, put our voice in this area.
I know one of your interests is in disadvantaged groups.
Yes.
What is your particular point there?
Yeah, it's that when we talk about empowering patients, it's also, a new public management word that we should empower patients. Sometimes we tend to forget that there's a whole group there which is disadvantaged in every area. They are, both socially and maybe also something they can't really read when we hand over written material. They don't understand to follow a treatment. And so I do believe that the nurses have a really specific role here, a very important role to take on the lead to help these groups, disadvantaged groups, because they also sometimes I think we tend to treat and care for people that looks like ourselves, and the ones who doesn't, we tend to, how do we reach them? Because sometimes they don't attend, patient education or relative education classes that we provide for them. The disadvantaged groups, they tend to, where are they? So I do think that the nurses, the cancer nurses, have a really significant role here and to take the lead.
A professional approach to this is going to make all the difference, because as long as people are aware of it.
Exactly, and of course education is also very important here, to educate the nurses about the disadvantaged groups, so they will really be aware of this group, because they are the cancer is also becoming a social disease, because you see that survivors and there are a lot of survivors, but for the one who is disadvantaged, it's actually going the other way. It's so for many,
quite a warning. And nurses, I understand, you think should have more of a political voice nationally.
I do believe that. Before I became president for EONS, I was president in the Danish Cancer Nursing Society, and one of the things that I really put forward was in the political arena was to have a specialized education for cancer nurses, 1 year education at master level, and that was dealing with politicians and writing letters and coming to meetings, and I do think that a lot of nurses should do the same in the EU. Now EONS is trying to do that, and I do think we have a voice. I think we should speak up. I know it sounds really like, can we do that? I do believe we can.
So finally, what would you like to see happening then in the short and medium term?
I would really much like that nurses will become a part of the multi-professional team, and to in that way to influence in the politics, both national and also European. I think we are getting there, but still a lot to do.
And are we getting there with personalised treatment and care?
That's a way. That's a way to do it, and the way we have done it was through the patients, because they have stronger voices. If you are a patient, and a lot of the politicians, even maybe they for themselves have had cancer, or they have a relative who have. So when there come a patient and say something, so that's the way we have done, to link with the patients there, because they have a strong voice in EU. So now they know us, some part of it. So that's the way I think is very important for the future also.
Thank you very much.
Okay, thank you.